Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer, the information provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition. And also, please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is also not intended to replace professional or medical or other kinds of advice. So, in this recording, we will be looking at how do I know things are going well? And I've highlighted it for you on the list of topics that we are covering in this breastfeeding class series. So, how do I know things are going well with breastfeeding? What do we want to see? Simple answer is indicators of effective breastfeeding include baby is gaining weight as expected, the feeding is comfortable, and the excess is excreted in the nappy. So, let's have a quick look at each of these. So, weight gain is the acid test that a baby is getting enough to eat. So often, breastfeeding or milk supply is blamed for a baby's behavior. But if the baby is gaining weight and the mother and baby is not in pain, look for the problem somewhere else. So, if you remember from a previous recording, weight loss is usually less than 7% during the first 3 or 4 days. Any weight loss greater than 8% might be a sign that breastfeeding needs to be evaluated, keeping in mind that intrapartum fluid administration that can cause a baby to be born with an inflated birth weight and thus a greater fluid loss after birth, usually the first day or so. Anyway, we don't want to see any weight loss after day 3. We want to see baby start gaining weight by day 5, and baby should have regained their birth weight by 10 days to 2 weeks. If a baby hasn't regained birth weight by 2 weeks, this also could be a sign that breastfeeding needs to be evaluated. And then after that, we want to see the baby gaining weight steadily, following the path on the chart in the Road to Health booklet. And an average weight gain is roughly 30 grams a day, but a baby may gain somewhat less or somewhat more. Okay, another sign is excess is excreted in the nappy. So all meconium is usually passed or will be passed by 48 hours after a few transitional stools. Maybe for 24 hours or so, the stool becomes yellow. So as I said, another indicator of effective feeding is at least a few yellow seedy bowel movements in 24 hours after day 4. So, a lack of bowel movements in a breastfed baby could be a key indicator of inadequate calorie intake. So, babies usually have at least 3 okay bowel movements in 24 hours. So, at least during the first month or so. Maybe there might be fewer poo nappies around 3, 4, 5, 6 weeks of age. So, a okay size is a thumb and a forefinger circle. So, yeah, but anyway, in the first month, breastfed babies should have a few stools every day. And these stools are usually loose and seedy and soft and unformed and yellow colored and occasionally a green one. And babies also have a strong gastrocolic reflex, so they tend to have a stool with feedings. um, Many wet diapers and no stool could be low calorie, low fat intake, and this might require just maybe like a minor adjustment in breastfeeding to increase the amount of high fat milk by allowing the baby to feed until satisfied on the first breast before offering the second one, and then also maybe doing some breast compressions while the baby is feeding, etc. Now, most parents don't even notice a wet nappy because it's mixed with the poo nappies. Some suggest 6 or 8 wet cloth nappies or 5 or 6 wet disposable nappies per 24 hours by day 4 with the urine that is clear or pale yellow. But we expect wet and poo nappies. But the major message is we want the poo to be yellow by day 4. And then another indicator of effective feeding is that feeding is comfortable for both mom and baby. and that baby is satisfied and content after feeding. So if you remember from a previous recording, we will see or hear baby swallowing during feeds. Baby might be feeding 8 to 15 times in 24 hours, maybe 2 or 3 hours apart. Sometimes it's clustered. The length of the feeds itself may vary also throughout the day. Sometimes they're short, sometimes very businesslike, sometimes leisurely and prolonged, sometimes just a series of snacks. Babies may be falling asleep towards the end of the feed, or at least be content for a while before feeding again. And they will have these little nice limp and relaxed hands, and on their face, a kind of an unworried expression. So, indicators of effective breastfeeding in the mother: she might have noticeable increase in firmness and weight and size of her breasts, and a noticeable increase in milk as well, around day 4 or 5. Her nipples should have no evidence of damage, and breast fullness is relieved by breastfeeding since the baby drank the available milk um, before she's offering the second breast to the baby. And as I said before, the baby doesn't need to have to feed from both breasts with each feed. If the baby just wants one breast per feed, that's fine as well. Next feed, or for the other breast the baby didn't take. But please contact a breastfeeding specialist if you have any concerns about your baby's breastfeeding. I've said this before as well, but whatever position the mother and the baby chooses, it should be comfortable for both mother and baby, and we want the feed to be effective. So you can stand on your head and breastfeed if you want to, so long as it's comfortable for both mom and baby, and that the feed is effective, meaning the baby is getting the milk that they need. And if the baby is effectively positioned with a deep latch on, that's also going to prevent sore nipples, and give baby more milk for their efforts. And I've mentioned this as well in a previous recording, and we will look again at this in a recording on troubleshooting. But please notice what the nipple shape looks like immediately after it comes out of the baby's mouth. Any misshapenness needs to be addressed ASAP. Um, and the way it's misshapen could indicate how we need to adjust positioning, which we will chat about in a later recording. So thank you for watching this recording. In the next recording, we will look at coping with engorgement. Please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And feel free to just subscribe to this channel for more breastfeeding class recordings. And take care till next time.